So without any further ado, I present Dr. Kier.
Hi, everyone. Thank you for being here. Let me just share my screen so that you can see my presentation. Okay. Today, I want to talk about vaccine acceptance and why it's important to know why people take a vaccine and also the reasons why people are hesitant to take a vaccine. The first thing I want to tell you is that this information is really not applicable to individuals who might be labeled anti-vaxxers, people with very, very strong opinions about not having any types of vaccine. Those people we're not going to worry about during this presentation because it's very, very hard to change their mind with any type of evidence, anecdotes, or anything in terms of becoming willing to take the vaccine. This presentation is really for the middle group, for people who are on the fence about potentially taking the vaccine and may have some hesitations. I will talk to you about ways to approach such individuals and to understand what works and what doesn't work when talking to people about vaccines. So in October, recently, 6 months ago, only 58% of the general public said they would actually receive a COVID-19 vaccine if it was offered to them. That has since changed. Many more people have now seen the tens of millions of individuals who in this country have been vaccinated and have seen that there hasn't been significant negative outcomes to them getting that vaccine. They've found more evidence. They've seen more evidence that the vaccine is safe and effective. And the number of people willing to take the vaccine has actually gone up dramatically. And each and every week, it continues to rise. There are certain factors that people take into account when they think about accepting a vaccine. Number one, are there side effects? We've heard those questions today. Does it work? Is it safe? And how much does it cost? These are some of the main concerns that people have. And these are the concerns that healthcare workers have to be able to answer for their patients. Generally, vaccines are accepted when the healthcare team that is offering the vaccine says that it's safe and can say it with confidence, when there's no cost to the individual, and when, for the COVID-19 vaccine, it will open up places of employment, it will open up school systems so children can get back to doing what they should be doing in classrooms, and the vaccine should also be easy to get. There shouldn't be barriers and obstacles to having to get a shot. We often, when you talk about vaccine hesitancy and acceptance, one of the key terms is vaccine confidence. And vaccine confidence is how much trust do patients, how much trust do providers have in the vaccine, in the people who administer the vaccine, and in the sort of the larger development and safety, the manufacturing of the vaccine. So these are some of the things that people take into consideration. Willingness to accept a vaccine generally falls on a continuum. There are people who are very, very willing to take it, who, right when it comes out, they want to take the vaccine. There are those who very much will never get the shot, who just absolutely refuse to have, whether it's this vaccine, whether it's an MMR, whether it's a vaccine for chickenpox, they just won't give themselves a vaccine, and they may not give their children a vaccine as well. And then there are sort of the larger portion of the population who really takes a position of passive acceptance, that if you approach them and offer them a vaccine, they will take the vaccine. In general, the rationale for a vaccine is if the risk of the disease is greater than the risk that the vaccine has, you should be giving the vaccine. However, And we know right now, we know that the COVID-19 vaccine has much less risk than the risk of actually contracting COVID. If you contract COVID, you may die. If you take the vaccine, it's very, very unlikely that you would die. But people misperceive risks, and they do this all the time in their daily lives. People often fear the wrong things. So when you think about people having a fear of flying or a fear of driving, the most common thing that you hear is that people have a fear of flying. And the question always is, why would they be scared of flying when we know that flying is so much safer than driving? Driving carries so much more risk than actually flying. But the perception is that flying causes more anxiety and causes more fear. There are reasons for that. We also know that people tend to be very concerned about genetically modified foods, but they tend not to be concerned about, just sitting around all day and not moving. When we know that kind of having a lifestyle where you're not getting exercise, where you're sitting in a chair all day, is actually much, much worse for you than genetically modified foods. So we see that there are often misperceptions connected with things. And vaccines also have a level of misperception that has been put on them rather than the correct perception that the disease, that COVID-19, is actually the risk that we're fighting against. Also, people have a difficult time understanding medical information. Medical information is very complex, and often if you read the actual studies that are put out on the Moderna vaccine or the Pfizer vaccine, they're filled with statistics and tables, and it's very hard for people to kind of just break through all of that technological and very specific language to understand what's being said. So that sort of creates a problem for the average person to really understand how safe the vaccine is and how well it works to prevent significant morbidity and mortality, significant death and illness in people. There's also, in our culture today, there's a lack of what's known as evidence culture. People no longer give as much weight to sort of this objective evidence. People tend to be more moved by stories, by individual stories. And it's very important to understand that, we can give people all the evidence that we have about a vaccine, but if someone comes out and says, well, I had the vaccine, or my spouse had the vaccine, and 2 days later they had a heart attack and died, that actually carries more weight to many people than all the studies out there saying that the vaccine is safe and effective. Also, people are drawn to correlations. People are drawn to perhaps false beliefs that, there's been a long history over the last 2-3 decades that maybe vaccines cause autism. We know that's not the case, right? The evidence points to that vaccines do not cause autism. There was some false science out there put out by a medical doctor, and it really led to a whole movement against vaccines. There's also the social influence, that component that leads people to fear vaccines more than they should. The CDC has put together a strategy, a national strategy for reinforcing confidence in COVID-19 vaccines. Number one, you have to build trust. You have to share clear, complete, accurate data, messages about COVID-19. About the vaccines, and you have to build trust in the community that the vaccine is safe and that the vaccine is effective. You also have to be able to convince healthcare workers themselves about the safety of the vaccine and to get vaccinated. It's very important that healthcare workers lead by example and get vaccinated, and also are able to recommend the vaccine to their patients without hesitation. I'll stop here for a second and let you know that I've been vaccinated for COVID-19. I did it not necessarily for myself, but for my larger community, for my family, for my parents, as well as for the patients that I meet with in person, so that they're protected from me possibly passing the virus to them. I think it's important for healthcare workers very much to lead the way, and lead the way by example. And finally, it's very important to engage communities, to listen to communities, to understand where the fear is and where the concern is. I think that some of the things that you can do is you can ask people questions about either what they've heard about the vaccine. And it's interesting when you ask people, what have you heard about the vaccine? If you're a medical professional and your patient has the impression that you are for giving the vaccine, they actually won't tell you how they truly feel and maybe what some of the fears are, some of the things they've heard about the vaccine. Instead of approaching the individual by saying, hey, what have you heard about the vaccine? Perhaps it's easier for them to talk if you said to them, what have you heard in your community about the COVID-19 vaccine? It sort of removes the personalization from them sort of owning their own opinion and perhaps being hesitant about giving their own opinion to someone who may not necessarily share that opinion with them. So sometimes taking an approach with the patient, say, hey, what has your community, heard about the vaccine? What are you hearing in the community? They're able to really speak at some of the perhaps distrust of the vaccine, fears, lack of knowledge that then can be dealt with by the medical professional. In general, this is a study that came out about, who do you really trust about the vaccine? The number one person is their own doctor, their own physician. People tend to trust their personal healthcare provider who knows them. They tend to take their suggestions, and this is why it's very important that doctors get on board and are able to give a very clear message to the patient that, it's in your best interest to take the vaccine, and I highly recommend for your safety that you take the vaccine. You'll notice that for some reason, President Trump was at the bottom of trust. I don't know. All right. It's important to understand reasons for vaccine hesitancy and to target clients who have these barriers, whether it's an economic barrier. Not everyone can take off from work and go and get a vaccine during the day. This is why New York State has opened up 24-hour vaccine sites. They've opened up vaccine sites in the evenings. They've opened up sites on the weekends, because you really need to remove all barriers so that people can get the shot. If there's a lack of understanding, if people are worried about side effects, you really have to listen to them. You have to understand their concerns, and then you have to address them. People who have a fear of pain, it's very important that, you can talk about, yes, the shot is going to hurt, but momentarily. It's a lot different getting the shot than it is getting COVID and getting really sick with COVID. In general, the target of the vaccine campaign is really those people sitting on the fence, the people who are not quite sure, should I wait? I want to see how other people do getting the vaccine. We want to vaccinate as many people as possible, and it's important that we talk to the individuals who have some concerns about getting the vaccine and really make a case with them. One of the things that research has consistently shown about people is that, the emotional appeal is much better than sort of the dry science, right? It's very hard to show people data and make a case that they really understand. You can't use probabilities. You have to use stories. You have to tell stories to people for them to understand the importance of being vaccinated. We also know that, sort of when the media sensationalizes side effects or one person getting sick as a consequence of the vaccine, and maybe it's not even related to the vaccine, people tend to get scared. And we know it's easier to scare people rather than to unscare them. And so it's important not to do that right away. All right. How do you effectively have a conversation about the vaccine? Start with empathy, start with understanding, assume that people want to actually be vaccinated, and be prepared for their questions. There are common questions people ask about the vaccine: side effects, cost, what to expect, how well does it work? I've seen in the chat, does it have eggs in it? I mean, these are the questions that people ask, and healthcare providers have to be prepared to give accurate, understandable answers. At the same time, healthcare workers have to be able to give a very strong, clear recommendation for taking the vaccine. They should not be hesitant about, well, maybe if you want, or maybe come back next time. When someone comes in the office, the notion should be, it's time for your vaccine, rather than do you want to take the vaccine? And it's important also to listen to, respond to questions, and you also have to proactively explain side effects. People have a right to know the side effects that potentially can happen with the vaccine, even if they're minor. In general, an approach that highlights the social benefit to others that cannot be vaccinated is very useful in getting people to actually take the vaccine, because this vaccine is less about you doing it for yourself. We know that the vast majority of people who get COVID are going to be okay. All right. But there's a subset of the population, if they get COVID, they'll be extremely sick. And there's another subset that is going to die from the vaccine. In this country, already 500,000 people have died. This pandemic will be over even without a vaccine at some point. It might take another year or two without a vaccine. The difference is whether another 1 million people die or not. Taking the vaccine is not necessarily about yourself, but it's about doing for your family and for your community, and for those who really cannot be vaccinated, such as newborns. They're probably not going to approve a vaccine for newborns, so everyone should be getting the vaccine to help protect them and to contain the spread. And finally, this is about, vaccines should be made the default option by medical providers. The assumption should be that someone is coming to the office and that they're on board with vaccination. Vaccines should be offered and not questioned to people. We know that the data generally shows that when individuals are given a direct statement that today is your day to be vaccinated, rather is, do you want to think about being vaccinated? The percentage of people who actually refuses versus accepts in the end is very, very different. It's important for healthcare providers to come in with a strong message of please be vaccinated today. So that's pretty much it, what I have for you. If there's any questions.
Thank you, Dr. Kier, for that great presentation. And yes, before we move on to our next panelist, I do want to ask you some questions. So Dr. Kier, how can we help people to deal with the anxiety and fear that are associated with getting vaccinated?
Well, I think it's a very real thing. There's a number of reasons why people have anxiety, and sometimes it's a fear of the unknown, of not having enough knowledge. When you can provide individuals with real knowledge about what it's like to be vaccinated, about potential side effects and what those side effects could be like, and about the benefits, anxiety tends to go down. Real knowledge does help people. It provides them a level of reassurance.
And what would be the best way to approach someone who has been misinformed, and maybe that is the cause of why they have fear and anxiety?
I think it's very important to hear people out, to listen to them. It's important to understand what information they have and where they got it from. And sometimes it's not necessary to combat that information, to push back on it, but to add additional information and other sources to round out their understanding. It's very hard to get someone to unlearn something that they've already heard.
I think that was a great point you made, Dr. Kier, how when someone is speaking to you, instead of saying you're wrong or you're misinformed and you trying to combat what they're telling you, instead you just add some information. And our last question is, soon teenagers will be able to get vaccinated. How can we talk to teens about the safety of the COVID-19 vaccine?
Well, I think, the healthcare providers will talk to them. In general, the vaccine is very, very safe. The side effects tend to be from your body developing an immune response, actually, and that's a demonstration that the vaccine is actually working. There's very, very rare side effects. Occasionally, someone has an allergic reaction, but they've taken precautions to prevent that from happening. At all vaccination sites, you're required to wait for 15 minutes, sometimes for 30 minutes, depending if you have a pre-existing allergy to something, to show that there's no side effect. And if there is a side effect, they can treat it on the spot. So vaccines are safe. It's important to give children knowledge and also to give them an understanding of why they're taking the vaccine, why they're being offered it.
Thank you, Dr. Kier, for that great presentation. And now, without any further ado, I'm going to present our next panelist, Ms. Zotto.
Hi, thank you, Jonathan. Thank you, Dr. Gardner and Dr. Kieger. You've certainly set the ground for me to move forward with the presentation that I'm about to give. It'll be brief. It's really just updates. Let me share my screen. It's updates on where we're at with not just the vaccine, but ultimately where we are with COVID-19. As you can see, of course, we are all very excited about what the vaccine is doing, what we're seeing, not just in New York City, in the United States, but globally. As you mentioned already, Dr. Kieger, I also received the vaccine. I was also sick with COVID and got the vaccine, not just because of the protection that it provides me, but ultimately because I love to do the work that I do. And not being sick with COVID-19 allows me to do the public health work on the ground in making vaccine accessible to our most underserved. So just to continue with the context of what it looks like in terms of COVID-19 transmission. So even though we are excited about the fact that COVID-19 transmission continues to decrease, we are at 6.93 positivity citywide. That means for all of the boroughs. Nevertheless, we continue to see hospitalizations. Nevertheless, we continue to see mortality or death related to COVID-19 infection. And I'm going to scroll down. I'm going to give you a lot of information, so please bear with me. But what I do want to underscore and related and connected back to what both Dr. Gardner and Dr. Kieger both shared is that in terms of Pfizer, Moderna, and the Janssen, also known as the Johnson & Johnson vaccine, what it means in terms of the clinical trials, no steps, there were no shortcuts. All of the steps were followed as they should be followed for any clinical trial. The reason why we have a vaccine for adults and not yet for children is because the burden of the disease has been among adults. The burden of this disease continues to be among our older population. And so again, reiterating that while overall, right, the darkest blue line that you see here, 6.75 among 100,000 people visits the hospital. The most number, the greatest number is among our older adults, as you see here, 75 plus and older. When we look at admissions of who stays at the hospital, again, it's our older adults. So when we think about the eligibility of this vaccine, when it's very limited in terms of production, in terms of distribution of the vaccine, in terms of the administration of the vaccine, the reason we continue to underscore and prioritize our older adult population is because of this graph, right? Because of the fact that our older adults are the ones that are being admitted at greater rates by comparison, even when many, perhaps the younger populations, are seeing higher rates of COVID transmission, of COVID positivity. To continue with this theme around what it looks like, I also want to share a latest update so you can look at what your neighborhood looks like, what it's looked like historically, what it looks like right now. I'm going to enter a Bronx zip code 10456 so that you can see and you can have this accessible. I'll put all of this, all these links in the chat box. But now this is a new addition to our data page that says the population for that zip code what it looks like in terms of cases, what it has looked like in terms of deaths or mortality, and just so you see it in terms of comparing it to what that zip code looks like in relationship to citywide or all of the 5 boroughs. So this is just information for you to have in your back pocket that you can access it. It's publicly available. And I encourage every one of us to look at it so that we remain current as to not just the transmission of COVID-19, but ultimately why it's important to have this information ready and on hand. Now, there was an important question asked when Dr. Gardner presented of what the new variants are. Because of the feedback that we've received from community members during community sessions much like this, we were asked to make this information available in public. And these are the new variants or strains of the virus that is publicly available to all of us, right? What we are seeing currently in New York City, and I won't belabor the presentation because I know we are also short on time, but ultimately what the data looks like. So what does it look like for the variants that we currently see in New York City in terms of how the distribution of it in our 5 boroughs? And moving right along, because we continue to see COVID-19 transmission, because we are seeing these variants in New York City, it is important to continue with the preventive measures, even in the face of this life-saving additional toolkit or additional tool that is the vaccine. We need to continue practicing what we already know and very familiar with, which is covering your face with the mask, and now the new recommendation of double masking with the disposable face mask and then a cloth mask over that, especially if we're going to be outdoors or in public spaces, of staying home if you feel sick, of practicing physical distancing of 6 feet or more, and making sure that you wash your hands as often as possible. If at any point you feel you have been exposed to somebody who is COVID-19 positive, or if you feel that you are showing COVID-19-like symptoms, we also encourage everyone to get tested. There are many locations that offer a free test, regardless of immigration status, regardless of whether you have health insurance or not. And lastly, as part of our toolkit, the vaccine. Make sure that you secure a vaccine if you are eligible. Now, what is vaccine distribution looking like in New York City? You have heard all of us say how limited vaccine access is for New York City. I think it's important to note what distribution looks like in terms of not just the production, right? So it gets produced, but now how does it get distributed to the different locations throughout the United States, but specifically New York City? So it's reserved by the federal government for New York City, depending on the size of our population. It is delivered to New York City, and it's delivered directly to many of the providers, the healthcare facilities, all of the providers that currently have authorization to administer the vaccine. And then we administer it to New York City residents pending eligibility. In terms of the total number of vaccines, we have a total doses delivered as of today of over 3 million. Now, just to contextualize it, right? We have over 8 million New York City residents. It also includes kids, but we're so close to approaching having a vaccine for all and for every single adult that is eligible. So for Pfizer vaccine, you can get it as young as 16 years of age. For the Moderna vaccine, you can get it as young as 18 years of age. For the Johnson & Johnson or the Janssen vaccine, you can get it as young as 18 years of age. So we currently have over 3 million doses that are available to New York City residents. And it's something to applaud that we have already surpassed the mark of over 1 million New York City residents fully vaccinated. And that's something that is only done by the sheer effort of our healthcare providers, by the sheer effort of our public health providers, and for many of our currently on this forum that are so vested in assuring that we get the appropriate information to all of our New York City members. And moving right along here, that is COVID vaccines. how to find the vaccine. We have a vaccine finder, and I'll show you in a minute what that looks like. Of course, there have been many, many barriers, especially for our older adults, in accessing a COVID-19 vaccine appointment, especially online. We do have a phone number, 877-829-4692. And believe me, we have heard the feedback from community members that it is incredibly difficult to find a vaccine, a COVID-19 vaccine appointment. And now that we have more vaccines available to us that are more portable, meaning like the Janssen or the Johnson & Johnson vaccine that is much more portable than the Pfizer vaccine, that is much more portable than the Moderna vaccine, we are now taking intentional effort to partner with community-based organizations, to partner with faith-based organizations, to meet our community members where they are at, so we can make a COVID-19 vaccine accessible to all. So when we talk about lacking vaccine confidence, it's also about accessibility. And it is also about meeting individuals where they're at in the spaces that they trust, such as a faith-based organization, such as a community-based organization, and having more vaccines available is part of that assurance. So it is important that we also know what we need to guarantee that we are eligible to receive the vaccine, because the vaccine continues to be limited. Although we are having more access to the vaccine, we do need to provide some level of proof that we either live in New York City in any of the 5 boroughs, or that we work in New York City in any of the 5 boroughs. So for individuals that perhaps do not live in New York City but work in New York City, we need to show some level of proof that our employer or the place that we work at is located in any one of the 5 boroughs. So how do we find a COVID-19 vaccine? One of the improvements that they've done is that they've consolidated, and this is again based on feedback from community members. And as we get more vaccine, we've consolidated all of the possible locations to actually show you the sites that are currently showing vaccine appointments. And as you see here, 7 locations statewide, but that are within proximity of New York City, have COVID-19 vaccines available. Now, it's important to also note that there's a difference between a first dose vaccine, because there are some health facilities or some facilities that are only giving the 2nd dose of the vaccine. So it's important to know which facilities are offering the 1st dose of the vaccine if you haven't received your first dose, and which locations are offering the 2nd dose of the vaccine, because you now have to set up your appointment for the 2nd dose of the vaccine if you have Pfizer or if you have for Moderna. So again, to reiterate what was already underscored by Dr. Gardner, if your first dose of the vaccine was Pfizer, the 2nd dose of the vaccine has to be Pfizer. If your first dose of the vaccine was Moderna, your 2nd dose of the vaccine has to be Moderna. Now with the Janssen or the Johnson & Johnson, it's a 1-dose vaccine. So once you receive your vaccine of that Janssen or Johnson & Johnson, you do not need a 2nd dose. And as Dr. Gardner also underscored, right now we do not know yet, until we get more information, of if we will need a booster or how long the immunity or the protection from the vaccine are offered from the vaccine. Not yet, but it's shown great promise nevertheless. So what was, and this is my last slide here, not last slide, but ultimately the last page. As of March 1st, the food industry expanded to include food bank, unpaid or paid employees. So pantry workers, food pantry workers, individuals that deliver home delivered foods or home foods, because you work with a community-based organization or a faith-based organization, hotel workers, and as you know that as of even February, individuals with underlying conditions. And the list is long, which is important to note what the underlying conditions are. It includes type 1 or type 2 diabetes, individuals that suffer from obesity, individuals with immunocompromised conditions, heart conditions, chronic kidney disease, as well as cancer. The list is here, so please, please keep updated with the information that is needed in terms of the eligibility. I think that as the more vaccine that becomes accessible to New York City, the the more opportunity to expand the eligibility to all New York City residents. And I will close here in case there are any questions. Thank you. I'll stop sharing my screen.
Thank you, Ms. Soto, for this great information. And yes, I do have some questions for you. So there's a reluctancy around Black and Brown individuals to get vaccinated. What is the city doing currently to educate the community about the safety of the vaccines?
It's a great question, and thank you for that. I also do want to, before I respond, I know that there's been tremendous talk around and important conversations around lack of confidence in the vaccine among our community members that are people of color. But I also want to note that much of it is related to a lack of information. And rather than call it hesitancy, I just want to call it perhaps lack of confidence and perhaps lack of information. And I think the more we build it in a positive sense, I think that greater trust we will have, because a lot of it is just not having enough information in our communities. So what is the city doing? One of the things that the city is doing is conducting public forums much like this in languages that are representative by the diverse communities that are here represented in New York City. More recently, as of last week, for example, I conduct many of my presentations, not just in English, but in Spanish, because I'm fluent in Spanish. And I think during the week, I conduct anywhere between 10 to 15 community sessions, much like this, offering this type of information, answering questions, not in an effort to convince anyone to get the vaccine, but ultimately to provide information so that when anyone is ready to make that decision to get vaccinated, it is an informed decision, right? Informed by scientific research, informed by what the data is showing, informed by personal experience, right? As a person who was sick with COVID-19, and I had the privilege, because of the work that I do, to receive my vaccine. And then what does that look like for me? What does that look like for people like me, right? That because we are on the ground and because we love the work that we do, how important it is to receive the vaccine so we can continue to serve our community members. The other part is that there are many indigenous populations in this city that speak other languages, Native American populations, but I'll speak specifically to the indigenous populations. As of 2 weeks ago, on a weekly level, including tonight, we deliver the presentation in Spanish, and it gets translated to Mixteco, it gets translated to Garifuna. Tonight, I forget the language that is being translated to, but I can tell you right now, in terms of being more equitable in giving the information to our community members and meeting them where they're at in terms of the languages that they speak, and seeing language as equity, right? So just so that, because I do want to promote it as well. So I'm using this opportunity to promote tonight's session. So tonight's session will be in Spanish and then translated to Quechua. And we have many of these. Additionally, we're working with faith-based organizations that reach many of our Black communities in an effort to one, meet the community or take the vaccine where the community is, working together with large food pantries. And again, the Johnson & Johnson or the Janssen vaccine, because it is much more portable, because it is something that is more like a flu vaccine and does not require the type of refrigeration that the Pfizer vaccine or the Moderna vaccine requires, it gives us greater access to many of our underserved communities. And I know it was very long-winded, but I really needed to share the amount of work that we are committed to doing as an agency and together with other city agencies. So DOHMH does not stand alone. We work together with many of our sister agencies.
Thank you so much, Ms. Soto, for answering that question. And I want to thank the panelists, Dr. Gardner, Dr. Kier, Ms. Soto. I want to thank the audience, and I'm going to pass it now to my colleague, Anthony, for closing remarks.
Thank you, Jonathan. And again, thank you to our panelists for, just doing such a great job. And before we enter the final inning of our webinar, I kind of want to share a poll so like that you all can just give us feedback on how we can better our webinars, because your feedback is so crucial to the betterment of this program that we provide here for all of you. So please just take some time to just fill out the polls. And while you're doing that, I just want to say, I want to give the utmost gratitude to our keynote speakers today, because you all just honestly instilled a certain confidence in myself, and I'm pretty sure to our audience as well, to kind of make a better sound decision in, you know, either taking the vaccine or just being more informative, so that we can speak to our individuals or family members with much more information. So thank you all. I hope you all enjoyed that. And if you haven't done so already, please just put your emails in the chat box so that you can participate and receive the information that was given today. It will honestly, truly mean the world to us if you can please go onto Google or Yelp and give us a review, because there are individuals that are out there who are seeking services, and, you know, just people reading about our program and learning more about what we do can benefit them in the community. Because at the end of the day, us, NYPCC, we're open 7 days a week. We do not have a wait list, and we answering our phone call all the time. So please just give us a review, follow us on Facebook, follow us on Instagram at NYPCC. And I look forward to all of you. And without further ado, we'll just go straight into our checkout session. Because as customary, we want to hear from our participants on how they felt about today's webinar, and, you know, if they took away any information or knowledge, or how they're feeling, or whatever the case is. So now we can enter our checkout session. Thank you, everyone.
All right, Cruz, you're back on the main room.
I am?
Yes, you are.
Oh, can you hear me? Oh, wow. Hi, everyone. This is so wonderful. Dr. Gardner, thank you so much. Oh my God, we're starting to have you here today. Thank you, Dr. Kier. And thank you to our returning friend, Ms. Soto. You guys were amazing. So we just wanted to get some feedback from the audience. And if there was anything that it was left out, any question, any last question that you would like to ask Dr. Gardner. So she's still here with us, so that we can just, you know, keep bothering her with more questions. So please feel free to do that. Let us know how it went. There was anything that we left out that would help if we have, and just your feedback in general, so that we can improve and make it better every time.
Also, stay tuned for our upcoming webinar, which is April 12th.
Yes. Anyone?
All right, so everyone, you could just unmute yourself or raise your hand if you don't want to speak.
Good afternoon.
Hello, everyone. Hi. Oh, I just had a question on the poll. It won't let you for the English part, but it won't let you submit it unless you answer that question that's in Spanish. I understand a little Spanish, so I knew that what it was saying. But for those who don't understand, they need to click on that button in order to submit it. So
okay, that's a good.
Did you use the Spanish interpretation room as either a yes or a no? But thank you for that.
Yeah.
Thank you. Any feedback?
Good afternoon, everyone. Hi, Cruz.
Hi, my love.
This is Naomi Vasquez from the Mud Haven Community Partnership Program. Good afternoon, everyone. Hope everyone is having a nice afternoon. I'm pretty sure leaving here with a lot of information. I'm really grateful Ms. Cruz invited me to the session, and I shared the flyer with a couple of my residents that we work with, and I'm just very thankful. And I just have a quick question, because this is one question that popped out on my Coffee with Vasquez yesterday, is that for any of the doctors that can help me out in this question, just for the kids who have like respiratory problems or any type of problems in health, regardless of what it is, but especially mostly respiratory. When a vaccine is available, do they need to get it? Or if the parent has any concern, like will they be able to get like any type of feedback on that?
Okay, I guess Dr. Gardner maybe will be able to.
Yes, I'll answer that, especially as a pediatrician. So I would say this is a great question. And I would say it's very similar to the adults. I think these are conversations that you have with your physician. If I think about what adults have asked us about, asthma and respiratory issues, and do they have diabetes and all of these other things, all the things that children can have as well. The answer was that's the exact reason why you should get the vaccine, right? Because you are more at risk. So I think that when the vaccine is available to children, you will get more information in regards to who will be able to take it, who won't be not. I think it'll be very similar because vaccines are not new. So I think if they'll say the same thing about if you had an allergic reaction in the past or things like that, but we don't withhold vaccines from anyone who has those conditions currently. So I can't imagine that would be any different. So that's sort of the answer. I don't know if it's the answer you wanted. I wish I had something more definitive, but we really just don't at this time. I think the jury's still out.
Thank you so much, Dr. Gardner. I really appreciate
welcome.
it. It helps me understand a little more the question, and whoever asked me that question, and particularly me myself, I'm also in sync with that question because I have a kid and he's asthmatic. So, and he's really allergic, like to anything. My son is just like, you blow him and he's already allergic to that. So, that's why I asked that question, and that's why I understood the question of a resident who asked me that question on my session yesterday. So thank you so much for clarifying that. It was really helpful. Thank you.
Thank you.
You're very welcome. I have asthma and allergies, and I got it, or I got the vaccine. Again, it's a personal choice, and I cannot stress that enough. I put that in the chat, but I say that again. No one is mandating, forcing anyone to take it. Although I do think, and Angela can step in on this, but I do think just as a public health measure, I think the reason that they're giving cards is because if there may come a point where other countries require us to show the card. I mean, there are things that if you go to certain countries, you got to get the yellow fever shot, and you got to get the, there's vaccines you have to have in order to go typhoid and what have you, in order to go to other places. I think other countries and us as well may ask to see the card. So I don't think that is out of the realm of possibility. But at the end of the day, right now, this is a personal choice. So you have to go through whatever, like I said, mental gymnastics that get you there. But hopefully we're all just hoping that you get there, no matter what flips and turns and back flips and whatever you had to do. We just hope you get there eventually.
Thank you, Dr. Gardner.
We have Alba. We have Alba.
Alba, you are on, Alba.
Oh, sorry. Hi, good afternoon. Can you hear me?
Yes, my love, we hear you.
Hi. First, I'm gonna apologize because I came in a little late. I was having a hard time trying to get the information to log in, but it was a great presentation. Just as a part, I wanted to let you know that I got both of my vaccines. I will call myself the guinea pig for the family. After I got it, my daughter went and got it. My son followed. My in-laws followed. The husband is on the way. It's like a chain reaction. So when I think one of the questions was, how would you get the teens to get the vaccine? I put it in the chat that I think once they see the parents doing it, the teens are most likely to follow.
Sure. It makes a lot of sense. I think that we role model, right, for our family.
Yes.
It's always
yes.
a strong individual in the family that people looked up to, and that's speak for parents, and children. That's a lot of time they do what we do. So I think that it's important also to use those influences, right, in our family to be the first one to. We hear from the doctor. We hear Dr. Gardner and Dr. Kier, where they spoke about, this has been 44,000 people, participate in the trial, and nobody went to the hospital. All died from that. Only 12 people out of 43,000 people got an adverse reaction that, didn't take them to the hospital. So I think that we have to continue to say what Ms. Soto said, and just really bringing the information, and what Dr. Key also mentioned, that the accurate information. When people tell us something that we know that is not true, we don't have to fight back, but just, bring the information to them. Thank you for that, Elba. Anyone
Next
else?
up, we have
You're welcome.
Bila. We have Bila.
Come on,
Elias.
Elias.
Yes, my question is for Dr. Gardner. First, Dr. Gardner, as well as the other panelists, thank you so much for such excellent presentation and explanation of this vaccine. So the two questions I have is first, with the Moderna and the Pfizer, which consists of the mRNA, will that alter the DNA? And then the second question, for anyone that has autoimmune disease, like I have a niece that has a autoimmune kidney disease or other immune disease, whether it's rheumatoid arthritis or what have you, can they still, is it safe for them to take the vaccine as well?
Okay, so I'll answer the second question first. So lots and lots and lots of people who have autoimmune diseases have actually gotten the vaccine. So that's already been happening. And I know personally people who have autoimmune diseases and who got the vaccine. Everything from anything you can think of, from Crohn's disease to lupus to all the and everything in between. Again, what I said to them, people who have asked me, I said, these are conversations you always have with your, as the other panelist said, like, your doctor, you chose your doctor, right? So your doctor is a credible messenger to you. And so I always say, have these conversations with your physician only because they know you. They also know how you, how you think, how they need to, have these conversations with you. And so I always say, have those conversations first so that you get that comfortability. But most people will tell you that once they got the vaccine, there was such a sense of relief of, I did this thing that has sort of been, a thing, right? And so I did it, and there really is a sense of relief for that, but it's okay to go through all the steps that you need to do to get there. That's okay.
Okay.
I don't know if Angela wants to, I'm happy to answer the first question.
Okay.
Angela, do you want to answer the question about the mRNA, DNA thing?
So yeah, thank you, Dr. Gardner. Although you did an exceptional job, so I hate to take that part from you, but yes, it does not. The mRNA, again, as Dr. Gardner mentioned, and as that great video mentioned, it's really just almost, if you think about it, of like a recipe. It's a recipe for our bodies to basically say, okay, check, check, check. I have all the ingredients, and then start responding with an immune response and start developing the antibodies. So if I am ever exposed to the COVID-19 again, my body knows exactly how to respond. So the mRNA is just one technology. And as Dr. Gardner mentioned about Dr. Kizzy and Dr. Corbett, in terms of the decades long of work that went into the research of this mRNA technology. So even though it's new for vaccines, it's not new for any other, like we've used it for cancer treatments. So I think that this has opened up so many opportunities in terms of future vaccines that get developed really on the shoulders of this mRNA. And I don't even know, I think I forgot the question that you asked, and I'm sorry if I'm not answering and I went off on a tangent.
No, the question was, would the mRNA alter someone's DNA?
Oh, their actual DNA.
Yes.
And the answer is no, but Dr. Gardner, please.
Okay, yeah, the answer is no. Yeah, the answer is no. I was actually going to jump in to say something, and then I totally forgot, but it was in line to what Angela was saying. So if it comes back, I'll put it in the chat.
Okay, and then last, thank you to all of the hosts and co-hosts of NYPCC for putting this wonderful session, very informative. I'm so grateful to all of you for doing this.
Thank you, Delia. I hope that you keep coming back.
Yes.
If I may,
every month we hear the second Wednesday or every month at 2 o'clock, same time every month we're here with something else going on.
Wonderful.
Thank you so much.
I do want to say something that I think, if I may, and sorry to take airspace, but I like what Dr. Gardner said. I know that when I took my first vaccine, the first shot, it was like an emotional, and I think it's an appropriate space to bring this up, an emotional release. It wasn't just, it was so much because we've been carrying so much. And then it also came with a little bit of guilt. Like, for example, my mother who's not here, who doesn't live in New York City, she's here with us still, who doesn't live in New York City, she couldn't have the vaccine. So I felt so guilty that because of the work that I do and the privilege that I have to have access to this vaccine gave me that opportunity. But I also ended up thinking about this preventive measure that saves lives and the many individuals that were not given that opportunity just because this tool, right, that we have, this preventive measure, this vaccine, is only available now to our communities that have been the hardest hit. So in this effort to do right by our communities, like, let's get informed as much as possible, and let's get us closer to the information that is gonna give us the most informed decision in whether or not we wanna get this vaccine, because we've seen too much already.
And if we like to hug people, we have to,
Yes.
hug them. We can't hug you if you don't get the vaccine. There was a question there, Dr. Gardner. Somebody put in the chat, would the CDC report if vaccine caused any death?
Okay, so I'm going to answer two questions, actually. One is, somebody asked about Dr. Keisha Corbett, right? Corbett, C-O-R-B-E-T-T, and Keisha is it's like Kizzy, K-I-Z-Z-M-E-K-I-A. If you put in K, it's going to, like, the moment you Google it, it's just going to pop up. Like, do you know what I mean? Dr. K, and it'll just come up. So, because everybody's been Googling her. So the answer to your question about whether the CDC, they will post it, as well as the pharmaceutical company posts all of their adverse reactions, as well as there's a place in the CDC called it has a long acronym, VERS, which is basically vaccine adverse reactions, right? And so they do post vaccine reactions. The problem isn't really rather the CDC posts reactions or deaths. The problem is do you trust the CDC, right? So this question is about trust. This question is not about whether they're going to post it or not. Do you know what I mean? And so that's really the issue, which comes to the heart of some of the stuff that has been said today, is that it matters who the messenger is. And so if you don't trust the CDC, if they posted there were 5 deaths, you think there were 15. Like, it's just like, do you know what I mean? So so I think it's important. I tell it straight. I always try to do that. It is what it is. I talk about everything, when I talk about race, I said, the colonizers, like, they were colonizers. Like, are we not going to say that? Like, that's what it was. Like, do you know what I mean? And so, and so I think that, right, we just have to call it what it is. And I think, whoever's the credible messenger in your life, or in your village, or, in your circle, in your sphere, I think those are the people you go to for that information. So yes, they will, but I think them alone won't be enough if you don't trust them.
That's true. Thank you so much, Dr. Gardner. Any other question before we close?
Yes. Can you hear me?
Yes, we can hear you.
Okay.
How are you? And first I want to start off, excellent panel. I have a question for Dr. Gardner and Angela. Fantastic information, and certainly heartfelt that you're sharing. I think we need to hear that more within our communities in terms of experiences, in terms specifically moving forward. So my question actually is for both Angela and Dr. Gardner. Already I am hearing in the community this perception. I have taken both the vaccines. I'm okay now. I can hug. Everything is going to go back to normal. My question is, how do we instill that cautious level with the community that we serve? Okay. Again, I'm James Dyke. I'm the director of outreach for Acacia Network. But how do we again send that message out that, hey, quote, everything is not okay yet? You know, yes, we're moving in the right direction, because I'm hearing already it's very a minority voice, but I'm hearing is I have both vaccines, I'm vaccinated, everything's going to go back to normal.
Okay, so yeah, so and I think like what's happening across the country is not helping, right? So what's happening in Texas, what's happening in all those states, the list that have said, okay, I mean, you know, everything's fine now, we're just gonna be normal, is not, it's like a realm of non-reality. Okay, so and so what your question is, your question is important and legitimate, because this is exactly where we are because of the messaging that is occurring across our local, state, and our federal governments, and why there's not continuity because of politics. Let's just call it what it is, right? And so how do we get past that on the ground level? Is that we have to continue to say, you know, yes, we're going to wear our mask, or you know, it's so funny. I was at an event yesterday. It was a small, intimate group. You know, we did all the right things. Everybody wore a mask, what have you. But there were a number of people in the room as we started to talk that were vaccinated, right? So we realized, oh, so when we were like taking a picture, I was like, oh, you're vaccinated? Oh, great. So I can take a picture with this person because they're vaccinated, right? And so we were like, okay, I take a picture of you. But yet we were like, but if we post it unvaccinated, like nobody knows, like I'd have to post, I'm vaccinated and therefore I can be with this person who's also vaccinated, right? So I think that we still have to do the work that says, you know, because everyone is not vaccinated, right, is that, and only 10% is vaccinated, that we still have to do the things that we need to do so that the other 90% that is not vaccinated won't end up having bad and poor outcomes, because that is still a risk, right? That is a reality, and that is a risk. And the numbers don't change. We are still having deaths every day, and it is literally like Russian roulette. And so it is scary. It breaks my heart. And so, and Angela is 100% right, is that as you know, as those of us who got the vaccine, we realized that it just came too late for so many. And so that, and I have to share this, and then I'm gonna let Angela respond to your question. I decided to do and Angela might know about this. I decided to do, there was a course at Harvard. It was on preventing the next pandemic, and it was a course about Ebola. Okay, and it was quick, whatever, 7-8 weeks. It was all webinars, and you could just do it all in like a week if you wanted to. But the point I bring that up is that during this, it was done pre-COVID. So it was done in 2014, 2015. It was a global thing. And Ebola, there were 12,000 deaths worldwide in Ebola deaths, 12,000. That seemed like it was horrific, like it was unimaginable. They thought and so this was about how do we prevent ever having 12,000 deaths? How do we prevent, because 12,000 deaths is unimaginable. We currently have 500,000 deaths. So this is why information matters, and why history matters, right? So that we have to make sure that we are armed with information and sensitivity to where people are.
Excellent, thank you.
Dr. Gardner, you said it beautifully. I have nothing more to add. It was perfect.
Beautiful. Thank you.
Can I say something, Cruz?
Yes, Rita.
Hi, how are you doing? How are all y'all doing? Good, good, good. I would have to say that this information, this segment was very informative, very beautifully done. It even had me changing my mind to go get my vaccine because my mom, she keeps badgering me, when are you gonna get it? When are you gonna get it? And you know, we have access to where we could, you know, unfortunately, a lot of people have to go through hoops to go through it, but she's like, you can get it easily done. Go and get it. Go and get it. So I'm like, no, Mom, I want to wait. But hearing this segment really persuaded me now to go and get the vaccination. you know, but you know what the thing is? How do we get it into our community, right? Because the conversation and the history content of it was relatable. The words were relatable that you could say, yes, this happened, and certain terminology that was used, and people sometimes they have to do with brown and color skin, right? In order for them to say, okay, that sounds a little better coming from the other race. You know what I'm saying? Because of course there is history there that makes our community don't want to get the vaccination. So now it's like, how do we get this kind of segment to beautifully generate out to our community? You know, I think that's the key right there. And I think a lot of it would change a lot of people's mind if they hear it like this or whatsoever.
We need to replicate more Dr. Gardner's and Angela Soto.
That's a good point, but I also think that the job that Dr. Gardner is doing, and Angela and Dr. Kier previously presenting, I think that we are the messenger. I think that they bring into us the information. I'm not sure that Dr. Gardner is only one person that can really actually, she should train the world, because when I met her, Sarita, I felt just like you. I said, if I was not vaccinated, after her presentation, I would be like, just do it.
Yes, no, exactly.
I feel the same way.
I'm like, I'm ready now. I feel like I'm ready.
But I think that we can be, like Elba mentioned earlier, we can be those influential people in our community. Start with the people that we know, that we love, with the neighbor, our friends, and it's like the domino effect, right? If we learn it, we can pass it on, and that's exactly what we need, that we can inform each other about this very important thing. And that's it.
Cruz, can I add something to that? I'm sorry. Can I add something? Can I add something to that? I did this you know this because I did this talk, and I would be remiss if I don't say this. When we talk about, and I'm going to talk specifically because when I did my presentation in the town hall, they asked me to specifically talk about the Black community. Right, so my town hall presentation was targeted towards that, but I ad-lib a lot, so it's fine, right? But I want to say this because this is important. The Latino community is very concerned about immigration, and particularly concerned about ICE. Okay, right? And the truth is, right, because I've been doing this work since 2008, okay? So in 2018, we know about separation. But before the separation occurred, okay, so I'm on the front lines of that. I work on accompanied minors who come across the border. So I know this work very, very well, okay? And I've done it under 4 presidents now, okay? And the reality of it is this, okay? I had children come to me, right, who were picked up while they were coming out of church, when they were in the library with their tutor, okay, while they were walking down the street, okay. So the truth is that fear is real. So we don't negate that fear because that happened, and that happened to a lot of families, and a lot of families witnessed and were traumatized by what they saw and what happened. So we have to address that happened. But the reality of it is that we can address that and say that is a real fear and a real concern, and say at the same time, it's not an either or, it's a both and, that the truth is, however, is that you do have community health providers that you trust, okay? And that they are saying, in spite of that history, right? That this is still important and that this is still necessary in this community, and that we have to have, you still got to take the vaccine because your lives matter. And so it is important that we acknowledge that and say, yes, you are correct, but however, not but, however, we still have to do this too. And those are the kinds of conversations that we have to have with individual populations.
Thank you, Dr. Gardner, so much for saying that. Thank you. If no one else has any question, it is very customary for us to leave you all today enjoying a fabulous song that was handpicked for all of you. So we hope that you enjoy this song. Dr. Gardner, I take my hat off to you. Thank you and blessings, many blessings for you to doing this for your Black and Brown community that need it the most. Thank you, Angela, for joining us and doing this specifically for the Black and Brown community that, again, needed the most. And Dr. Kier, I don't think he's on the screen. Thank you also for doing this for the Black and Brown community that needed the most. Thank you so much. And I know for a fact that we're not going to be, this is not the last time that we're going to be each other. I'm going to be one of those groupies following Dr. Gardner. Whatever she is, we're going to be there. Thank you so much. Enjoy the sun. I'm hoping to see you soon. Take care.
When you're feeling low and there's no one around, when it looks like it's over and life's got you down, hold on to me, brother. I'll be here when you need, 'cause there's a brighter tomorrow. This I truly believe, 'cause everything, yeah, everything is gonna be alright. Everything, yeah, everything is gonna be alright. 'Cause when you're feeling low and you can't see the light, everything, yeah, everything is gonna be alright. So wipe those eyes, it'll be alright. 'Cause everything, yeah, it'll be alright.